So, hi everyone. A very good evening to all of you who have joined us today. And today we are going to talk about, yes, the most high yielding course currently on the DAMS Alpha app. And yes, a lot of people had queries about how to utilize the new DAMS Alpha app for their preparation, right? So I'm going to talk about one of the courses today, and then yes, we will navigate through the app and we will talk about other courses as well. And we also have Dr. Sameer with us, so welcome. Okay, so when we talk about the DAMS Alpha, this is the homepage of what the app looks like, right? So, right, this is the
Anji, most welcome to today's episode, and our goal is to show you how we, work on the app and what is the new thing that you do on the DAMS Alpha. So the first thing we wanted you to see together with us is the first feature that you see on the screen now. The feature that you see on the screen now is called as the quiz of the day. It is called as the quiz of the day. So every day on your app, 5-question quiz is uploaded. Every day on your app, we upload a free 5-question quiz. It is free for everyone. You just need to download the app and start participating. So let us do it together now. This is how it would look like. Okay. And let us now start the quiz. Okay. I'll ask Dr. Deepti to attempt the answers so that we can do it better.
right. So I'm just going to randomly, just put the things for you. So whatever it is, so you just attempt the quiz. Okay. I'm just doing it randomly so far, just to show you that yes, this particular feature is free for everyone. And when you submit, you will get what is your particular ranking. Yes, so as you can see here, you will get what is right, what is wrong, and you can then view the leaderboard completely. Okay, and we always tell our students, try to come on the leaderboard, right? So the leaderboard will show you the top 10, but yes, you can expand the list if you want to see your name and see where you lie, right?
So now we go back to the app, and our goal is to tell you that the first thing you need to do is you need to be thorough with the daily quiz. Are you able to understand? Okay.
Okay. So we are just navigating currently the homepage of the app, right?
Okay. The second feature we wanted you to see is the case of the day. Every day a clinical case is posted on the app. All you need to do is you click on the case and you can start interacting and start telling what is your answer and how do you look at the question or what is your answer about the that particular case. And if you want to just participate and see all the quizzes, all the cases that have been uploaded so far, you will see a button on the top called as view all. Just click on view all. You will be able to see the archive of the cases that have been uploaded so far, and it is a good fun that you are learning something clinical every day side by side. It is a free source on the app. You can use it. You just need to download the app and create a profile. You don't need to purchase any course to participate in the daily quiz. You don't need to purchase any course to participate in the case of the day.
Right. So, this is the home page, and so far we have talked about what are the top 2 features on the home page, which are yes, free for everyone. Apart from this, yet another free feature is the Doctor's Lounge, right? So you all know me and Dr. Sameer have been coming live every day in the morning at 10 a.m. Okay. So every morning live at 10 a.m. and that live is available on the app itself. So we are live on the YouTube. Okay, and it is live on the app as well. So, in case you don't want to use any social media, yes, you can attend this live free session. Again, yes, as I said, it is free for everyone, even if you are not so far enrolled with us, but I'm sure that is going to happen, right? Then, yes, absolutely, yes. The daily quiz is free for everyone. The case of the day where you can interact is also free for anyone who downloads the app. The doctor's lounge and the transform session where you can connect to the mentors every day live. We talk to our students every day live. You can join in the session, which is again free for everyone.
And so, what is unique about the DAMS app is, I see Vidya is asking in the comments also, that these are the features which are free for anybody who downloads the app.
Yes.
Daily quiz, case of the day, doctor's lounge. So these are, when you scroll into doctor's lounge, you will see many videos by teachers, surprise quizzes. You will see a lot of things there. And the most unique thing is every day we'll talk to you on the app, which is very important to keep you guided. There will be a section on the MediMart to where you can buy your handwritten notes. We are soon going to launch the latest version. We have, and mentor desk. You can hear some podcasts. There is a section for news and articles where the daily news is there about anything update that is happening. Now what we'll do is, we will now shift to the most important course on the DAMS platform called as the Back to Basics.
Absolutely, yes. Now, if you are new on the DAMS app, the first thing that you have to take care is that if you can see at the top left hand corner, everyone, can you see the NEET PG course? So first of all, you have to select from there NEET PG, because there are a lot of options available here. For example, if you see, there is NEET PG options. There is a separate course for first year, similarly FMGE, USMLE, nursing. So DAMS is doing a lot of things. So the moment you download the app, the first thing that you have, or resident courses for that matter. So first thing you have to ensure is that on the top, what you see here is NEET PG next, right? And then when you want to, purchase the course, or if you have the course, I will tell you that as well. Currently, I have logged in from my own account. So on the screen, what you are seeing is my account. So in case we have to purchase, we have to go select NEET PG next, and we have to press Go Pro. Right now in the Go Pro, as I said, currently I have logged in with my account, so it's going to show something different. But other than that, what you need to know is, we have 5 courses, but today we are going to talk about only one of these, right? So as you see at the bottom is test series. Okay, so above that is deadly combo, right? Above that is back to basics. Then there is app TND, and then there is a app live course. So we have 5 plans that you can join in with us. And today we are going to talk about the back to basics. So we're just going to get the screen back in a moment, right? Okay. So now when you talk about, as I said, you select NEET PG next, and then you are going to press Go Pro, and you can, purchase the course from the Go Pro section. Now what happens after that is important, and then we will start seeing the inclusions, right? Okay, a moment please. Dr. Sameer is trying to put it on a different screen. So just give me a moment. Okay, right. So now Dr. Sumer has put it on a different screen so that we can scroll and show it to you. Now at the bottom panel, there is a option when you go to the home page. Okay, let's go to the home page. Once you have selected Go, Pro plan, which is back to basics today, from here you purchase the course, right? And where does the course go? Then the course goes into the home page, right? So you purchase from GoPro, you take the back to basics plan. And when you go back to the home page, Dr. Samir, can you push it back to the home page? Yes, at the bottom there is my study section. Okay, my study. So now let's see, once you have taken the course, it goes into my study section, and whatever will be the inclusions of that course will be shown in the my study section. So we need to see the inclusions in the my study section for back to basics. So when you take the back to basics plan with us, you need to know that you get a lot of inclusions in it. Okay, so as I said, you will see all your inclusions when you go back there in the my study section itself. For example, with the back to basics, you get the entire test series. Okay, you get the entire Q bank. So let me put it here. Right, so we are going to be back in a moment. At the bottom panel, there is a My Study section, right? Which is where the Back to Basics plan is what you can see. Now, let us see what are the plan inclusions, right? So, you get the online test series, as I was mentioning. You get the entire Q bank, okay? Then you get all 19 subject pre-recorded video lectures, right? Now, you will get the video lectures both in English as well as in English, right? In the Back to Basics itself, you will see there is an inclusion which is a second year prof courses. So you also get, apart from these 19 subject wise videos, you get special videos for second prof lectures as well as special videos for first prof lectures as well. Okay. Then it also comes with the revision course. Now, revision course, what all does it have? It has your PYQ ka BAP, both for INICET as well as for NEET PG. You have Mission INICET and you also have DVT. So all the revision courses are also included within your Back to Basics, right? So these are all the inclusions that will be there in the Back to Basics plan, right? Now, the most important thing, as we said here, is that when we go here, you will see all 19 subject recorded lectures, right? But there are some special features within this that you will be able to use. For example, there will be handwritten notes. Now, as you can see in this particular section, all the current handwritten notes, which are also being updated and will be very, very soon available, are available as a soft copy. Right? So all handwritten notes will be available within the course itself as a soft copy in a separate folder. And yes, the new B2B videos are going to be workbook based videos, right? So whatever are we teaching, that is all workbook based. So the videos are also workbook based, and so are the handwritten notes, right? So they are a perfect go along when you do the back to back videos. You will see whatever the teacher is writing, all that things in the workbook, whatever the teacher has annotated will be available here in a complete format of 19 subjects together. Okay. You also get workbooks which are going to be there as a soft copy. Now, why are we giving you both? Because there are both types of students. There are certain students who want to, fill in the blanks and put the things there by themselves. So they can definitely download the workbooks They can, save it in their phone or an iPad or, whatever you're using for your lectures, and you can annotate side by side in the workbooks. If you don't want to write at all, then you can use the complete set of handwritten notes, right? Then there is, most importantly, we are also giving you here the 19 subject DAMS integrated MCQ rounds. Now, MCQ rounds are done by 2 teachers. When we say integrated MCQs, it means 2 teacher perspective. So where you will see various clinical integrations of clinical subjects and basic sciences. So both horizontal and vertical integration will be there, which is actually a part of the new curriculum as well. So you will get MCQ discussions, which are integrated videos, which are 2 teacher perspective available here. Then one of the most recent 2 features which are very, very popular are a live recorded, version of LRR. So live rapid revision is available within your back to basics itself. It's a folder which is separate, and this is a folder which is available, as I said, for your rapid revision close to the exam, right? So let's say last 2 months before the exam, we are going to use the live rapid revision. So one entire set that was done this year before NEET PG has already been uploaded, and it is available to you right on the day 1 when you join the course. Apart from this, every year another live session will happen, which you will also get access to, right? So one season is available right on the day, the recent most season, and another one will come live. So live rapid revision is something which is very, very high yielding. It's not a different content at all. It is the same 19 faculties who have made these videos who would be doing a more concise version of revision close to the exam. Now this is they come with notes. Again, the notes are completely made by the same subject faculty. They are available in a downloaded format as well. So you can download it, save it in your phone. You can also take a printout, and you can highlight side by side while you're doing the lectures, right? So this is LRR. It is, yes, going to have a very, very high hit rate this year in the NEET PG exams. It is an absolute must do before your exams, in order so that we can do multiple revisions, of the same content by the same teachers. Then recently, we have now added the NEET PG PYTs. So if I press the LRR, this is what it will look like. So for example, there is anatomy LRR, there will be videos, there will be notes, and there is a workbook as well. So as I said, you can download the notes, save it in your phone, highlight, take a printout, whatever you want to do with it. Okay. Now, when we talk about NEET PG PYTs, this is the most recent feature we have added. So currently we are covering around 12 subjects here. And this, as I said, is PYTs. Okay. So it is going to have all the important topics, and what all has come from those topics will be mentioned here in a format which is very, very ready to do. So hardly 15 minutes per subject, and we are covering 7 years of PYTs here. So we will be giving you what has been asked, what is the answer. We will also be giving you a grand analysis in these PDFs as to which topics are repeatedly asked, how many questions are asked per topic. And as I said, we are covering last 7 years in this. Okay. Then yes, as you see, there is a section of 19 subject videos, right? So the videos, okay, so right, so we'll try and show you the videos in a different media player, and that is why we were trying to change it onto a different screen. But yes, this is what it looks like. For example, this is how you're seeing the radiology videos, and I'm just going to ask them to change the platform so that we can show you the videos as well. So just give us a moment while we change the screen, right? See, we're going to try and play one of the videos. And underneath the video, you will see we have timestamps mentioned. Yes, can you all see the timestamps? So where exactly in that particular topic, what subtopic has been covered is displayed. So as I said, the videos are all, yes, workbook based. The same workbook which will be available as handwritten notes, completely typed, and everything that the teacher has written would be available. For example, currently on your screen, you can see Dr. Sumay's video, and below it, you have different options. What we are showing you now is how the notes come below the video itself, right? So below the video itself, you can see the notes. You can also make them full screen. And there is a very, very special feature now that we have DAMS Alpha. We have AI on the app, right? So underneath the videos, there is a feature called as Cortex AI, right? And when you will press Cortex AI, you will see the golden points from that video will come by or will be given by the Cortex AI. It is going to be from the video what the teacher has told. So all the key things will come down in the form of golden points underneath itself. So for example, if you've seen one video once and you don't want to see it again, but you want to go through the various important sections, then one of the best ways to do it is through Cortex AI. In fact, we would say that all those students who are going to appear for the exam now, right? Suppose you know that certain area is a weak topic to you, right? For example, right now you are seeing how the Cortex AI has generated the golden points from the video itself. So once you know what your weak topic is, even if you are closer to the exam, you can just press Cortex AI. There is no need to even see the entire video again. No 1x, 2x, 3x. All those options are available. But Cortex AI makes it even more easy. So you at the click of the button, you will get all the golden points to ensure that you're not missing on any of the content. So what we recommend is once you've seen the videos at length, if you have to do it again, do it through Cortex AI. What is yet another method of doing it? You know, sometimes when we use different modalities, it stays with us for a longer time. And now when we say we have brought AI to DAMS Alpha, we have a very, very special educator on the app. And she is called as Myra, MYRA. So it stands for My Revision Assistant, right? So Myra is now there on the app. And you can actually listen to the video in the form of a podcast sometimes. And you know, this is something that I realized is very important when I was talking to toppers over past so many years. So one of the techniques that toppers use is that when they are reading, you know, you sometimes would record things and you want to revisit them during your internships or, you know, in a short frame of time. And that's where we use Myra, right? So you can simply press Myra and she is going to give you audio notes on that particular lecture, which means, you know, even if you feel like listening to something or asking something at midnight, you can use the AI features, right? You could use Myra, you could use Cortex AI. Anytime 24/7, they are there to assist you in your revision and rereadings, right? So those are these are very, very special things as far as the videos are concerned. Now, when we talk about 19 subject videos, you know, the beauty is that the content is super high yielding, it is concise, crisp, and yet it is going to cover everything that you need for your professional exams and everything that you need for your entrance exams, including NEETSET, including NEET PG, including UPSC, right? You name it, and it is going to be super useful. To help you, as I said, we also have a separate folder included in B2B as first prof lectures, a separate folder also for second prof lectures in case you want to dig deeper into the depths of these subjects while you are in your first year or second year. You could use even these additional lectures. Also, to help students, there are again two more very special folders. There is a special folder on practical courses and on final prof theory exam course. So how to write a particular question in the exam, what should be the format and different topics, and this is there specially for your clinical subjects, which is your final year subjects. Yes, as I mentioned, there is a separate folder for practical courses also included in B2B, right? So on the day one when you join, you have all these resources with you and you begin your lectures or start building your content. Content is the most important thing. But when we talk about content, we want our students to have a daily habit of MCQ practice. And that is where we will ask you to start doing DQB. So, which is very much included in your back to basics. So we would recommend that when you are reading a particular lecture or going through a particular lecture in the B2B, at the same time, concurrently, you should try and solve the topic wise MCQs in DQB, right? So the DQB has various types of MCQs. So yes, it also has PYQs, and PYQs are put separately. For example, INICET PYQs, NEET PG PYQs, UPSC PYQs, FMGE PYQs. And then we even have the older AIMS PYQs, which was before 2018. So yes, from 2014 to 2018, there was a different board in AIMS that was making the papers. So those are also available in the PYQ sections. So nearly, I would say, we have PYQs from 2014 till date within the DQB itself. So once we land up with the DQB, let's click on DQB now. So you would see, as I said, at the top, the PYQ section, and then at the bottom, we would be seeing the subject-wise questions, right? So now once we've seen the videos, we'll change the player so that now we can see the still things. And it would be on your screens in a bit. Okay. So as I said, at the top, initially you will see the PYQ sections, and then at the bottom there are subject-wise question bank things, and within the particular subject you will see a wide variety of questions. Okay, I'm just waiting for the screen to be back. Right, so that is how you see the Q bank. So in the DQB, as I said, the DAMS question bank at the top, yes, we were changing the media player, right? So at the top, there will be PYQs, right? As I said, they are exam wise. We have AIMS, we have UPSC, FMGE, NEET PG, and INICET. And at the bottom, you have subject-wise MCQs. Now, if I talk in detail, I'm going to just open my subject, which is obstetrics. And we want to show you how we have divided the topic-wise MCQs. So there will be lots of small modules that we want you to cover with every topic. For example, it is in the same order in which I teach in class. Like the first lecture you will attend in B2B in obstetrics is about fertilization and basics of reproduction. So that is the first module in the DQB as well. And it's not that there is, a vast number of MCQs. These MCQs are handpicked by the faculty themselves. And what is the best thing? The best thing is that when we look at these MCQs, for example, for example, we are saying the sperms will achieve motility in, right? The answer is the caudal end of the epididymis. So as I said, these are like hand-picked MCQs which will automatically cover your PYQs and PYTs, and at the bottom you will see a detailed explanation, but most importantly, you will see audio discussions of every MCQ in DQB. So whether it is PYQs in INICET, PYQs in NEET PG, PYQs in FMGE, or they are MCQs in every subject itself, they come with video discussions, and these are not very lengthy. See, our explanations are also based on why B is the answer, why others are not the answer, and so is the format of the audio discussions, right? So, why something is an answer and why is something not in the answer, not the answer. So this is not just for obstetrics. You would see it like this for every subject. And especially, as I said, you will get all types of MCQs. So if you see, there is a separate section of image-based MCQs available, right, in every subject. Again, handpicked by the faculty, right? So you will have these image-based questions, and as I said, once you see them, you will realize they cover almost everything, whether it is a PYQ or a PYT. So while you are doing back to basics, whatever subject you are covering, whatever subtopic you are covering, we want you to do topic-wise MCQs from it to ensure that we are not just learning the content and concepts, we are also learning the application of the same content in the form of MCQs, because eventually the exam is going to be in this format, right? Now, what do we want you to do once you finish a subject with us, right? For example, you have completed obstetrics. I would definitely want each one of you, once you finish a subject, go to the PYQ section and cover that subject's PYQs. For example, currently I am showing you INICET PYQs, and I will go to INICET, let's say obstetrics, and then we will be able to cover the INICET PYQ. So there are 139 questions from obstetrics in INICET. As I said, when we say INICET, it is from 2018 onwards, but before that the pattern was different, and then we have those PYQs also available in the form of AIMS 2014 to 2018 PYQs. Then if you have covered obstetrics, not just I want you to cover INICET PYQs, the same holds true for NEET PG. So after you cover the subject and the DQB, completion of the subject ke baad, you should go to the PYQ section. So they are subject wise, right? So this is the first way of going through B2B. You cover the lectures, they come with handwritten notes which are workbook based. So everything is only one now. It is all workbook based. The videos are workbook based. All the lectures are workbook based. The workbooks are available for you to even download and save it in your iPads or notepads. You can even take a printout. There is also a soft copy of the handwritten notes, and as I said, the handwritten notes are very soon going to be launched. They're all brand new based on the new workbooks. Yes, if you want to take a hard copy, then you will have to order it separately, and you can do that from the MediMart section of the homepage. But the soft copies are already available, so most of you would not actually need the hard copies, because we are already giving you the soft copies of the handwritten notes as well as the workbooks, both within your course itself. Now, what should we do in the next session? For example, I have completed my videos of obstetrics, I have done my DQB, and I have covered the PYQs. But after 3 months, I want to see how much of obstetrics do I remember, right? What are we going to do then? Now, this is where the role of test series begins. So yes, the entire test series, as you can see at the top, is a part of Back to Basics. Now, our test series is very, very, very special. It comes with multi-level testing. So let's see what are the different levels. Number 1, we have a section called as Grand Test. Then there is a section called as PYP, Previous Year Paper. Now please remember, when we said DQB, There we were doing PYQs in a subject-wise manner. Suppose you want to do the entire paper together. So as you can see, we have FMG complete paper, we have INICET complete paper, we have NEET PG complete paper. So you can do the entire PYP from here itself, which you can use for your reviewing if you want to do the subject again. The third section is called as Transform 10x mini tests. So these are the areas which we give as daily small targets to our students. So currently we are running two courses here, or two sets of test paper here. One is called as IBQ series, the other is clinical vignette series. And what is special? The Transform 10x is free for everyone. Yes, so please remember, it is free for everyone. Currently for NEET PG, we have unlocked the Transform 10x mini test. We are giving it as daily targets on our Telegram channel. So, you see the target and anyone can come to this section of the test series and you will have all the tests under this free. It's not just one. Right, so it has so many of Transform 10x tests on various formats. You will get IBQs, you will get clinical vignettes, you will get, various types of questions, like maybe you needed a test paper only on emergencies, maybe a test paper only on surgical classification. So all those special are available in Transform 10x series. They are a set of mini papers. They are specially made for habit forming. The next section that you see is called as a class test. Okay. Now class test there will be three different class test papers. So there is or I should say two different class test papers. There is a class test paper for NEET PG and there is a separate class test paper for FMGs. These class test papers are also made by respective subject faculties at DAMS. Every test, so as I said, we have 7 level testing in the test series. Every test is made by the faculty, and yes, all the class tests come with video discussions by the same faculty, right? So for example, you are seeing here anatomy class test by Dr. Sandeep. Similarly, you will see obstetrics class test by Dr. Deepthi, right? So class test papers are there for your, spaced revision. Now, if you remember, what was the order that I said? I said you do the videos, side by side you do DQB, and once you finish the subject, you do the PYQs. After a gap of 1 week, are you listening to me? Without revising, after a gap of 1 week, you are going to attempt the class test. So within a week's time frame, we want you to attempt the class test, which is for spaced revision. As I said, the CT is made by the faculty and it is based on current pattern of exams, which means the class test is based on last 3-year PYTs. Okay, when I say current pattern, we mean to say last 3-year PYTs which are there available in this CT. Every student must give the respective CT once they finish the subject as a spaced repetition. Okay. Now, what do we have? It's a very common complaint by students, right? Like, ma'am, 4 months baad mujhe lagta I have forgotten it. What do we do then? Then we have a special section called as SWTs, which are called as subject-wise test. Again, made by the faculty. They come with video discussions, but how are they different from a CT? The SWTs cover last 7-year PYTs, right? So the coverage is wider and deeper to ensure that we have a good depth and width of information, of content. We are able to apply our concepts as well. Then there are various other test papers which we keep giving as targets, like DVT test. For everyone, currently even the DVT test is free for everyone, so you can just come to the test series section and give the DVT test for your revision. They are based on the DAMS Visual Treat, which is the most loved revision resource for NEET PG. It has a very high hit rate and it is absolutely a must do in the last month of the exam, right? It helps you in rapidly covering all 19 subjects and you can actually do it multiple times. Okay. Then currently we are also doing a MIQ series, which is called as Most Important Questions, which again is free for everyone. You download the app, you can come to the MIQ. These MIQs are again made by the teachers, and there is a live discussion on YouTube every day at 7 p.m. Even today there was supposed to be a discussion of the physiology MIQ, but it is going to happen after my session at 7:30. So stay aligned. At 7:30 we have the physiology MIQ. The test paper you can attempt on the app, free for everyone. The live discussion will happen at 7 p.m. on YouTube. Okay. Then the last bit is the mock test papers. So we have again 3 sets of mock test papers, which is INICET mock, FMGE mock, as well as NEET PG mock, right? To ensure that we are doing a lot of test practice. The mock tests are specially made so that you attempt more and more tests closer to the exam. So in the last 2 months especially, we should focus on testing and reviewing our mistakes or wrong diary, for which there are mock tests and grand tests and many small mini tests available in the test series. Right now I would like to just tell you here that when you download the app and you go to the home page like this, I told you at the top we have to select NEET PG next. You will see these small toolbars. For example, we have created shortcuts for videos. So if you are enrolled with us in Back to Basics, you can directly go to the videos from this section as well. Then there is a shortcut for notes, and the third shortcut is for test, which is your test series, and the fourth shortcut is for your Q bank. So when you download the app, if you want to visit the free tests by DAMS, you just go through this shortcut. It takes you to the test series, and you will see that the Transform 10x, the DVT test, the MIQs, they are unlocked for you. At some intervals, we also unlock some of the mock tests, so they could be free from off and on in between. Okay. So as I said, these are the shortcuts that have been created. So once you enroll, you can directly go to the Q bank, directly go to the videos, or directly go to the test series through these shortcuts. Right now, what are we going to do once we are once we have done the Back to Basic videos? I told you the first revision can be very well done through the Cortex AI and Myra, and then you can do another revision through live rapid revision. Yes, so you will be able to do multiple revisions in a different format of the same resource, as well as practice lots and lots of tests. The idea is, first we work on the content, side by side develop the MCQ skill, give a lot of tests, and then revise, especially whatever we are doing wrong. Right? So Back to Basics is actually all inclusive. It has everything as a part of the inclusion. So this is my study section, and at the top I can see Back to Basics. You can see there is the icon for Myra AI here. So this is what Myra is going to do. She is going to ask you what you want to revise with her. So you can just press Myra. She's a very, very kind teacher. She's available for you 24/7, and she is going to ask you, so whatever subject you pick up, she is going to teach you something from that subject, but it is from your own videos. So the AI is scrolling on the videos. It takes out the important points told by the faculty, and it will revise with you. Now, what will happen if you press Myra again for the same subject? Is she going to teach you the same thing again? No. Every time you select Myra and the subject may be the same, she is going to teach you something different every time. So AI is smart. It is going to dig and keep a track of what she's taught you before, and she will do a different topic for you again. Okay. There is another icon in the My Study section. So once you have enrolled for the course, you go to My Study section. The first shortcut is Myra. The second shortcut you see is the schedule, right? So in case something special is coming up, you can see the schedule within your study itself. It is updated. So whatever would be coming up, you can see it there. Okay. So especially, when we talk about the live classes that are happening, because the DAMS Alpha app has 5 plans. So there is an app live plan as well, right? And there are time and off and on live classes happen. So all those schedules you will be able to see here depending on which course you have enrolled for. So whichever course you have enrolled for, you can see the schedule in the My Study section at the top. Okay, and what is very, very special in the DAMS Alpha app is that no doubt we are bringing AI very close to you to help you, but we haven't forgotten the human touch. So what is that? Myra is your revision assistant, but a very, very, very special feature on the DAMS app is where you can book a one-on-one session with your faculty. So this is called as the mentor desk. So on the home page itself, you will see just below the the doctor's lounge, you will see a section called as mentor desk. And the first thing there is book a one-on-one session with the faculty. So what the faculty does is they will upload their time slots when they are free. And if it matches with the doubts that you have collected, so if you have respiratory medicine doubts, Dr. Bharat is available. You book a slot for him. There will be a 25-minute session with him where he is going to only and only answer your queries. So you sit with your queries ready. Our assistants are going to ensure that the teacher has your queries beforehand and you can be there with the faculty one-on-one. So yes, the DAMS Alpha app comes with a lot of offerings, especially the new features are the inclusions that we are giving in the plans to make it a very, very wholesome experience, right? Now, back to basics is a self-paced study thing, right? So if you are someone who wants to study at a pace of your own, you want to make your own schedules, you want to play around, you don't want to do one subject at a time, right? Back to basics is the course for you. It comes with everything. You will never need anything other than this, which means it comes with Q banks, it comes with multiple level testings. Most of these tests are available with the video discussions. It comes with revision courses as well. So you don't have to take DVT separately. DVT is included within your back to basics. Mission INICET is included in your back to basics. INI PYQ ka BAP or NEET PG and FMGE PYQ ka BAP is also included in it. So we have the bigger course, which is back to basics, all 19 videos. Then we have a little smaller version of it, which is called as live rapid revision, which is also a part of back to basics. And then we have the ultra concise version with the revision resources. Why? Because at every stage of our preparation, we need a different way to study. So when we are 6-7 months, 1 year away from the exam, we want to be thorough. That's the time when you cover up your videos, your Q banks, your PYQs. As you head closer to the exam, you start giving more and more tests. There are class tests, there are grand tests, there are subject-wise tests, there are various mini tests, there are mock tests, you name it, and it's all there, right? So, and when you finally land close to the exam, what you need is DVT and PYQ ka BAP to ensure that the last lap of your revision, which is a month close to the exam, covers the PYTs as well as the probable topics in the right amount of depth, which is not very superficial, which is not very, very deep as well. So with ensuring that it has a very good high hit rate. So right from the beginning till right to the end, B2B is, as I said, a very, very wholesome course, giving you a 360-degree support, right? Besides that, the AI is now there to help you go through your revisions, whether it's a podcast or it's golden points. And last but not the least, as I said, we keep adding features. We have added LRR, we have added NEET PG PYTs to back to basics. So it is all there in the power of your hand, right? So let us know if you have any other details in back to basics. We will be happy to help. We will be coming back soon to tell you more about the other plans, which is App Life, TND, and a couple of short plans as well, right? So if you have any queries, we will be leaving a WhatsApp contact number under the comment section to which you can approach for your queries. You can also put your queries in the comment section, right? So go ahead, happy learning, and do let us know how your experience with the AI is. We are bringing AI closer to you to help you have a whole new experience of DAMS Alpha. So take care, everyone. We'll be back very soon with another course, and we will be telling you the features.